Dr. Gary Sykes, obstetrician at the Sydney Adventist Hospital, Wahroonga. Yes. Well, a natural childbirth is where the lady is able to deliver her baby spontaneously without the need for any instrumentation at all, versus what we call an operative vaginal delivery, where the obstetrician has to facilitate the delivery of the baby. And that is two options there. One is the use of forceps, and the other option is the use of the suction cap, where the suction cap's applied to the baby's head and delivery is facilitated by that means. Things have changed a lot over the years. In the past, certainly I tended to do forceps, a lot of forceps, and we did a lot more difficult forceps than what we do today, because suction caps were not as good as what they are today. Today, my preference is a suction cap, if an operative vaginal delivery, and the reason for that, it's less, potentially less traumatic for the mother. The forceps are applied to the side of the head, so therefore the diameter coming through the stretching the perineum is greater. With a suction cap, it's on top, so it doesn't actually increase the width. And quite often I can do a vacuum delivery without the need for with an intact perineum, which means an excellent recovery for the woman. Whereas forceps, you do tend to need to use do an episiotomy as well, or cut in the perineum to avoid a nasty tear. An induction of labour is where we artificially start the labour process, and there's different ways we can do that, and they vary according to the situation, the findings, and so the various techniques are used. But they're done for the majority of times because there's good clinical indications. For instance, a woman goes significantly overdue, this problems such as preeclampsia, diabetes, concerns about the baby's growth, and so on. So there's usually good clinical indication. But these days we're also finding that there's an increasing number of ladies who really don't want to go past their due date, and I get quite a number of requests by ladies, can I have my baby please? They want to be induced so they don't have to continue the pregnancy any longer than is necessary. So that's a new element that's arisen over more recent times, where it's an induction because of the patient preference. Some ladies have been told they should not be induced because induction is more painful. They'll have a more painful labour if they are induced. That's certainly not necessarily the case, and should not be a reason why, if there's good clinical reasons why the pregnancy should be brought to an end, that we allow the pregnancy to continue. Certainly inductions can be uncomfortable and certainly can be more painful, but that's not necessarily going to be the case. And certainly I've seen many spontaneous labour where they are very prolonged, and they certainly can be very painful. So while I would be sympathetic to what the woman is saying, I do not necessarily agree that's a reason why she should not be induced. When I talk to my patients at the very first antenatal visit, I tell them I have two goals for their pregnancy. The first goal is a good outcome, and the second goal is a good experience. But I also tell them I have absolutely no idea whatsoever how their pregnancy, how their childbirth experience is going to go. It's totally, absolutely unpredictable. Yes, every woman hopes she's going to have a very straightforward pregnancy, a normal pregnancy, spontaneous labour, an easy labour, normal delivery, and no stitches. That's fantastic. But sadly, that does not always occur. My goal is to have the patient working with me so we achieve that goal of a successful outcome for the mother, a healthy healthy baby, with the minimum intervention that is necessary. For some women that may mean a caesarean section. For other women it may mean an induction. For other women it may mean an operative vaginal delivery. But as long as we achieve that goal, I think that's where we should be focused. And I want the woman to say to me at the end that they've been very happy with my care. They've been very happy. So even though they end up with an emergent caesarean section, they understood why it had to happen, and they're very happy that we made that choice.